everyone. Today we will be discussing about drugs that are used in glaucoma. So basically, glaucoma is something which is caused by increase in the intraocular pressure. Is because of aqueous humor, as we all know. So first, let us understand in a nutshell from where the aqueous humor is secreted and where it is drained. So this is your lens. Suppose this is the lens, and these are the suspensory ligaments holding the lens. Then this is the ciliary body, and this is the iris cornea. So the aqueous humor is secreted from the ciliary body, and the direction of flow is like this: the anterior chamber, and finally it gets drained over here in the canal of Schlemm. So this kind of outflow is known as trabecular outflow. Another outflow is there, which is also known as uveo scleral outflow. But the maximum damage of the aqueous humor occurs because of the trabecular outflow. And a limited portion occurs because of the uveoscleral outflow. So, as because the intraocular pressure is because of the aqueous humor, and increase in intraocular pressure causes glaucoma. So, the treatment of glaucoma is mainly aimed at reducing the aqueous humor. Now, this aqueous humor can be reduced by two ways. Either you can decrease the secretion of the aqueous humor, or you can increase the outflow of the aqueous humor. So, how do we decrease the secretion of the aqueous humor? Okay, so this aqueous humor, it is secreted by the ciliary body, as we have already discussed. The ciliary blood vessels, which bring the blood to the ciliary body, the blood in the ciliary blood vessels is filtered to form the aqueous humor. So, as because the blood is filtered, if there is vasoconstriction of these blood vessels, so less blood will come and there will be less aqueous humor production. So the blood vessels are under the control of two kinds of receptors. These blood vessels in the ciliary body are under the control of two kinds of receptor. One is alpha 1 receptors and beta 2 receptors. So we all know that alpha receptors causes vasoconstriction. So if we give alpha agonists, or if we give beta 2 blockers, then there will be less of aqueous humor production. Apart from that, we can give carbonic anhydrase inhibitors to decrease the secretion. So what are the alpha agonists? The alpha agonists can be non-selective or selective. So non-selective alpha agonists, what are the names? The non-selective alpha agonists are adrenaline, and another is the prodrug of adrenaline, that is dipivarvin. Now coming to the selective alpha agonists. So the selective alpha agonists, that is alpha 2 agonists, are given, and these are apraclonidine and brimonidine. Okay, these cause the vasoconstriction of the blood vessels in the ciliary muscle or the ciliary body, and they reduce the formation of the aqueous humor. The second class of drugs is the beta blockers. Okay, so the beta blockers are, you can remember by the mnemonic TLC. T is for timolol, L is for levobinolol, and C is for cartiolol. So these three drugs, they are contraindicated in those having asthma. Another is the selective beta 1 blocker, that is betaxolol, but it is less effective. And out of these three, TLC, which is the longest acting? Remember, L for L, levobinolol is the longest acting drug. Coming to the carbonic anhydrase inhibitors. So the carbonic anhydrase inhibitors are acetazolamide, brinzolamide, and dorzolamide. Acetazolamide is usually given orally or IV, but brinzolamide and dorzolamide, they can be given as topical. Now in chronic angle-closure glaucoma or uh, closed angle glaucoma, the surgery is the mainstay of the treatment. That is either iridotomy or trabeculectomy. But the sudden attack of the angle closure, that is acute congestive glaucoma, the drug of choice is mannitol. The drug of choice is mannitol. But in closed angle glaucoma, the drug of choice is usually acetazolamide or carbonic anhydrase inhibitor. So this has to be remembered that in acute congestive glaucoma, the drug of choice is mannitol, and in closed angle glaucoma, the drug of choice is carbonic anhydrase inhibitor. Now coming to the second part. This is all about the first part, that is how we can decrease the secretion of the aqueous humor. We can decrease it either by giving alpha agonists or beta blocker, or we can give it carbonic anhydrase inhibitors. Now coming to the increasing outflow of the aqueous humor. So how we can increase the outflow of the aqueous humor? We can increase by either, there are two outflow paths as we have already discussed. One is the trabecular outflow, another is the uveoscleral outflow. Out of these two, the main drainage is by trabecular outflow. So what are the drugs which targets the outflow. Those are the miotics. Why miotics? Because whenever we give miotics, okay, there will be this aperture will be, the pupil will be constricted. So this will get distended and this canal will become patent. Okay. So that way the aqueous humor will be drained here. So miotics are useful in the glaucoma. So what are these miotics? This can be pilocarpine, physostigmine, icothiopate, and another is a Rho kinase inhibitor. And what's the name of the Rho kinase inhibitor? This is a new drug, so I'm writing it in different color. It is netarducil, netarsudil, sorry, netarsudil. Another Rho kinase inhibitor I would like to mention here is that is fasudil is used in congestive heart failure. Fasudil is another Rho kinase inhibitor which is used in congestive heart failure. It is not used here. Netarsudil is used in glaucoma. Netarsudil is used in glaucoma. So what are the side effects of this miotics? Now we will know. The side effects of these are cyclospasm, and there will be brow pain. And apart from this, all these drugs also cause stenosis of nasolacrimal duct. Now, ecotherapy, it may cause cataract. Okay. Now, what are the drugs which target the uveoscleral outflow or increase the uveoscleral outflow? These drugs are your PGF2 alpha agonists. PGF2 alpha agonists. And what are the names of PGF2 alpha agonists? These are latanoprost, bimatoprost, and travoprost. Now, what are the side effects of this PGF2 alpha agonists? So the side effects are, remember by the name of PGF. Okay. One is pigmentation of iris. So that is otherwise known as heterochromia iridis. Heterochromia iridis. Next is G for growth of eyelashes. That is hypertrichosis. And F is fluid in the macula. That is macular edema. So heterochromia iridis, hypertrichosis, and macular edema. These are the side effects of PGF2 alpha agonists. Now, apart from this, there are certain important side effects of the other drugs. That is, we can remember one is the miotics. What are the side effects? The side effects of miotics are cataract by ecotherapy and cyclospasm or brow pain and stenosis of the nasolacrimal duct. The side effects of the beta blockers, they are contraindicated in cases of asthma, bradycardia or AV shock, CHF, and diabetes. Now, apraclonidine, one important side effect is you can remember lead retraction. Lead retraction. Now, brimonidine, what is the side effect? Can remember BRI. So, brain inhibition, or that will lead to apnea, particularly in infants. And adrenaline, it is metabolized to another compound, that is adrenochrome. Okay, and that causes pigmentation of the conjunctiva. There is black pigmentation of conjunctiva. Okay, so let us revise within 2 to 3 minutes what we have read. So we have read what are the drugs used in glaucoma. So basically, glaucoma is because of the increase of intraocular pressure, and we have known that the aqueous it is because of aqueous humor, and this aqueous humor, it is formed by the ciliary body and it is drained by the canal of Slim mainly, which is also known as trabecular outflow, and this is the maximum drainage occurs by this trabecular outflow. The other type of outflow, which is a limited portion, is the uveoscleral outflow. Then this aqueous humor, how to decrease the aqueous humor? We can decrease it either by decreasing the secretion or by increasing the outflow. So how will we decrease the secretion? The decreasing of the secretion is by either by alpha-1 agonist or beta blockers or carbonic anhydrase inhibitors. In the alpha agonist, we have got non-selective and selective. In the non-selective, we have got adrenaline and dipivapain. And adrenaline, as we all have read, that side effect is that it is metabolized into adrenochrome, which causes black pigmentation of the conjunctiva, and the alpha-2 agonists are apraclonidine and brimonidine. So this apraclonidine has got a side effect of lid retraction, and the brimonidine has got a side effect of apnea, particularly in the newborn. And beta blockers, these are timolol, libobilinol, and carchiolol, and betaxolol. Out of this, betaxolol is a selective beta 1 blocker, and carbonic anhydrase inhibitors, we have acetazolamide, brinzolamide, and dorzolamide. Out of this, acetazolamide is given orally or IV or by systemic route, and dorzolamide and brinzolamide are given topically. So the acute congestive glaucoma, what is the drug of choice? The drug of choice is mannitol. And the other part is we can increase the outflow. The outflow can be increased either by the miotics. Okay, the miotics are the pilocarpine, physostigmine, and ecotherapate. Out of this, the side effect of ecotherapate is that it causes cataract, and pilocarpine and physostigmine, all these drugs, they cause cyclospasm and brow pain and stenosis of the nasolacrimal duct. And another is a Rho kinase inhibitors, which is netarsudil, and the other Rho kinase inhibitor is fasudil. This fasudil is used in the congestive heart failure. This is a side question which you need to remember when you're memorizing Rho kinase inhibitors. And we have other drugs which increase the outflow, that is PGF2 alpha agonists. The PGF2 alpha agonists are latanoprost, bimatprost, and travoprost. So the side effects of PGF2 alpha agonists are, you can remember by PGF. P is for pigmentation of iris, which is also known as heterochromia iridis. G is for growth of the irises, that is hypertrichosis, and F is fluid in macula or macular edema. Thank you, everyone.